And the Trump administration today rolling out more details on its operations in Minnesota, calling it ground zero for the war on fraud. Joining me now to discuss is Minnesota State Representative Kristin Robbins. Minnesota State Representative Kristin Robbins, thank you so much for joining.
Thank you for having me.
It's great to have you with us. So you chair the Fraud Prevention Committee in the Minnesota House of Representatives. A lot of attention on fraud in Minnesota, as we all know. Explain to us what you've uncovered and really what you're seeing is the major problem at scale here.
Yes, so the scope of the fraud in Minnesota is staggering, and we still are at the tip of the iceberg. So we've seen fraud in child daycare programs, autism services, a child nutrition program, housing stabilization, integrated community supports. Most of the areas of Medicaid that expanded since Obamacare, those programs in Medicaid had low barriers to entry, no caps on enrollment, and so fraud just seemed to mushroom in those areas.
Yeah, and you know, this discussion sadly is playing out as a partisan issue on the media. But what are you hearing from the constituents? The Americans have very low tolerance for this type of corruption.
Yes, Minnesotans are completely furious because they work really hard for their money. They're very generous. We want to provide, a safety net for people in need of help. But when they see their tax dollars being hijacked and sent to buy a resort in Kenya, apartment building in Nairobi, land in Turkey, luxury homes and cars, then that's the final straw. Minnesotans want to know their money is being spent for the purposes they send it to St. Paul to be used for.
How real is what you just described? And we're seeing a lot of action being taken, at least, starting to be taken on the federal level. What is being done at the local level to fight this type of fraud?
So my committee, which formed last year, we've held a number of hearings. We've been grilling agency officials. We passed legislation to strengthen internal controls and expand whistleblower reports. But without the help of the federal government, it would really be hard for us to do this without their help because our committee doesn't have subpoena power. We can't compel testimony. We can't get access to the bank records, the health records, the things we need to prove out the criminal charges. And so we've been working with our federal partners at the U.S. Attorney's Office, and now we're grateful for the help of the House Oversight Committee. I just was at a roundtable with Secretary of the Treasury, Scott Bessent, this morning, talking about the new financial tools they're making available. So this is an all-of-government approach, and that's what we need to be able to stop the fraud and then make sure that we're stopping this in other states before they get as bad as Minnesota.
In addition to Treasury and other steps being taken, the federal government adding an assistant attorney general specifically to investigate and prosecute fraud around the nation with a specific focus in Minnesota to start. Do you welcome this, and how do you think this will impact the overall situation?
I absolutely welcome it. That is what we need. We have not had this laser focus until our federal partners came in and the national attention got on this issue. So I reached out to the Center for Medicaid Medicare back in July and asked for a full forensic audit of Minnesota's DHS Medicaid programs. And now I understand Dr. Oz has authorized that, which we're so grateful for. And that's what we need is this help from the federal partners to get to the bottom of this. Because it's not just Minnesota taxpayers, it's everyone who pays federal taxes who is getting abused by the corruption and the fraud in Minnesota.
Now, what is your advice for other states in our country in how to detect and stop this type of fraud?
Right. The first thing is we need to have a no fraud, no excuses culture in your executive branch so that fraud, the minute it comes up, it's taken seriously and people are fired and held accountable. That has been absent in Minnesota. The other thing is to look for obvious red flags. A lot of times these are webs of interconnected people who are related by family or by clan or have business relationships. So one might have a Medicaid service program for assisted living, another might have an adult day services, another might have non-emergency transportation. But when you see a pattern where there's a lot of intersection, that's a really big red flag. And then also just follow basic internal controls. Minnesota's Department of Human Services has failed to make sure that verification of providers and recipients is happening. They shouldn't use attestation, require documentation for eligibility, and check eligibility frequently.
Are you sensing people are getting uncomfortable with what's coming in terms of investigations?
Not in Minnesota, we're grateful. We want to get to the bottom of it. Minnesotans were appalled to see the scope of this because we have always prided ourselves on good government, clean government. And when people realized how deep this is, how broad this is, I mean, partly it was sort of an initial denial, like they couldn't believe it was as bad as it is. But now people have accepted that and they want it cleaned up. So I hope that we can be not only the canary in the coal mine warning people about fraud, but the first people to really show how to clean it up.
Minnesota State Representative Kristin Robbins, greatly appreciate you joining us and best of luck.
Thank you for having me.